Hello, welcome everybody. We are in our beautiful new studios here at our Spidertech home. This is where it all happens. This is season 2, episode 1. We're excited to be back with you again. And for season 2, episode 1, we are going to dive into how Spidertech has an impact on the neck. So we're going to look at being able to conceptualize our way through the interactions with tape and skin through the neck and where that will take us in terms of helping your patients and clients. As always, our mission statement, short, sweet, and simple. We are aiming to elevate your client's recovery by arming you, the medical professional, with a streamlined kinesiology tape solution. We do this by providing you with the education, but also with providing you with the highest quality kinesiology tape made start to finish here in Toronto, Ontario, Canada, at our Spidertech home. And as you've come to love, it is made start to finish with our pre-cut shapes to provide you and your clients with the highest quality products to get the best results for your patients and clients. My personal experience, if this is the first time you've tuned in for webinars, I'm a chiropractor. I'm the Director of Education here with Spidertech. Been doing it for a number of years now. My experience sport-wise has always been in tennis and golf, two rotational sports, that as soon as the neck gets a little bit tight, we start to see some neck issues. As soon as the shoulders get a little bit tight, we start to see some neck issues. So neck pain was something that I've always tried to tackle. And certainly with Spidertech, it gave me an advantage where I could have my athletes wear it while they compete, and they could continue receiving care even when they were in the field or the golf course competing. So I had my hands on them at all times. And then also getting into private practice, as everyone's posture starts to kind of move this way as we get on our phones, on our computers, we certainly see tons of neck pain, and something I work with day in and day out many, many times. And then from a tape-wise, it's just so easy to use tape on this part of the body because there's no clothing, there's no issues. You just can put it on, and instantly, within seconds, you give your patient a better experience. If we dive into our objectives for today, the goals of our webinar, we're going to keep it nice and simple. We're going to learn about the science and using tape. Hopefully we can kind of conceptualize how we can use it for different parts, for different conditions that our clients have. And then we'll also go through some examples of how we can use Spidertech application-wise. And then always at the end, we'll do our Q&A. All right, so the advantages of Spidertech, as everyone is familiar with here, is that our tape comes pre-cut, machine cut, so it is easy to use, it is highest quality possible. We make everything Spidertech here, start to finish here in Toronto, Ontario, Canada. Our standards and practices are top notch. And then we are endlessly trying to improve our products, and so we end up with a product that really is just superior to the competitions. And as a result, you get to pass that product and that quality on to your patients and clients. All right, I want to start kind of breaking down a little bit how we're going to think about using tape, because how the kinesiology tape interacts with the skin, we can achieve different outcomes based on what the objective is. And so we'll go over some research, and the reason why we do this, as always, is to I guess first of all prove that it does work. It gives us ideas as to how well it's going to work. When you use anything on your patients, having an idea of what the expected outcome is very important. It also will kind of tell some stories as to the type of patients that you can help, and hopefully that kind of brings to mind some ideas of people you'll see maybe today or tomorrow. So our subgroups, we're going to go with just a general neck pain, and that is very general. We'll break that down further into muscle issues, so whether that's muscle tone, where like it's the tension that is used to maintain posture, muscle stiffness, that is the tension that the they report, and the feeling of tightness and soreness, as well as trigger points, which is something we treat day in, day out. The next piece will be range of motion, and that really is an extrapolation of the muscle tension in most cases. The range of motion increases will generally be a result of the tension going away. Certainly if we can take some pressure off the joints of the neck, and maybe then that will have an impact as well. But I would think most of the range of motion increases we see would be as a result of decrease in muscle tension. And then if we think of from a performance standpoint or just a recovery standpoint, proprioception becomes very important as we get better, as we start to improve and go through our rehab exercises. Proprioceptive awareness for our patients becomes quite important. So this is kind of an outcome that we can expect. And then we'll go through a example that I think we see day in and day out. It's a research paper that looks at Tech's neck, and so as a result of just kind of being hunched forward, and what the result of a flexed position of our neck and our cervical thoracic junction does to really the rest of the body. And it's a pretty interesting example. And again, it's something that we can. It's a way to kind of think about how we can help with kinesiology tape. So if we dive right in, our first study is they looked at, through ultrasound, tape's impact on muscle characteristics as well as pain. And so they looked at here at the upper traps. It's a common area for research to look at. And so what they did is they put a eye strip, as you can see here. So that eye strip went on one part of the body, or one side of the body. It was ipsilateral. It was over an area where people reported neck pain and trigger points. And if we jump to the next slide here, we'll kind of just buzz through that one, go to our next one, which is the results. There we go. So it is just a more easily digestible version of the previous study, or previous slide. And so what we see here is they broke it into categories. They looked at the reported visual analog scale, or pain perception, at rest, at activity, and at night. And they looked at this right after treatment, and then 1 month later. They also did have a checkpoint in here at seven at 1 week, but this makes it very easy to understand. So some pretty interesting and cool results where we look at rest. When we put the tape on over the upper trap, they saw that there was a 63% increase or improvement in their visual analog scale. And I will say that they included this with exercise. So they did their stretches and their chin tucks and the rehab exercises, combined that with kinesiology taping. And then after 1 month at rest, we saw that there's a 78% improvement. So they're virtually back to normal. With activity, the pain levels were higher. And so right afterwards, we still saw a 42% improvement. And then 1 month later, we were up to a 64% improvement. And then at night, which is something that makes life easier, we can sleep, we can rest. We see that right away we have a 75% improvement, and then an almost back to normal 89% improvement at 1 month. And so by combining exercises, we can see a pretty much instant improvement if we throw some tape on there. So if we kind of work this into what we normally do as manual therapists, if we did our soft tissue, if we worked on our joints, if we did whatever the treatment was, our modalities, whatever it was that you would normally do to help the upper trap in this situation, you throw some tape on there, combine that with the exercises you're probably already doing, we can see these really great results. And then if we go to the next slide, we see that here we get more of our objective measures. This was using our ultrasound, and we see that there was right away a 16% decrease in the thickness of the muscle of the upper trap, and this is the result of the irritation kind of going away. We see that continued through the 1 month, where we continue to see the muscle get back to where it would be in a normal state. And then our same thing with the diameter of our trigger point. They used ultrasonography again to look at the diameter, how big the trigger point was, and we saw that instantly we almost had a 30% improvement in how big the trigger point was, and we got to that. We had a 35% improvement or shrinking of that trigger point after a month. And so again, we expect that we see improvements in how people report the pain levels, how it feels, but also we see in how the objective measure is how the muscle reacts to the tape being on there combined with the exercise. And then, as you can expect, our conclusion was that we see a greater improvement in neck pain, disability, trigger point diameter, trapezius muscle thickness right away, 2 weeks and a month afterwards. And they finished with saying this could give clinicians a dependable and objective method to evaluate treatment response in myofascial pain. And so something we see all day, every day, certainly with the amount of postural issues that people have. Every time we see a trigger point in the upper traps, which would be all day, every day, getting some tape on there as your finishing move is only going to benefit your patient and your outcomes long term and instantly. Okay, so if we dive, so we'll kind of put that aside as hopefully proving or giving some understanding that that kinesiology tape is going to have an impact on the muscle itself. And so if we use that as a stepping stone, we can look at, okay, so how will that affect pain, and then range of motion as our second objective measure here. So if we jump to our next study, again, another recent one, and looking at, Italy, and this was a recent one as well. I believe 2022. They looked at range of motion here, and again, they're looking at short-term, quick hitting results, the type of results that we're really after with our patients when they come in to see us. And so if we jump to the next slide there, we'll see that with their range of motion evaluation, they were looking 20 minutes after they applied the tape, and then 3 days after they applied the tape. And they're looking at their active range of motion through the cervical spine. So evaluate range of motion, put the tape on, evaluate range of motion again 20 minutes later, and then evaluate range of motion 3 days later. Pretty simple. And again, the type of results we want to see with our patients. They do bring up here the importance of having the tape grip on the skin, elevate the skin, and lift it off. And the only way we're going to get that is by applying the tape with no tension. So how we would apply in this case is, because we're looking at the upper trap in this situation, they would flex, side bend their head to stretch out the trap, and then they would apply the tape up the neck from the acromion up the neck without tension. And so as a result of that, the tape would retract back on itself, lift it up, and we would get that nice accordion look where we get that elevation of the skin. And what that means is that we get as much interaction with the mechanoreceptors in the skin as we possibly can, and that's that mechanoreceptor interaction that we're trying to rely on to decrease our pain and, as a result, our muscle tension. And we kind of just normalize the tissue tension in that area. Also, since we're dealing with the neck, it's an area that we have a lot of tension it's an area that we have a lot of sensitive skin. And you can appreciate, if you kind of if we look up the tape through the neck there, because the tape has an elastic property on it, where the tape ends and the skin continues, you can appreciate that because the tape is retracting back on itself, it's pulling back to the midline. The spot where the tape ends and the skin begins, if we have a lot of stretch on that tape, we're going to increase the shear at that spot. And then if we went to side bend away again, we're going to end up with a lot of shear at that spot, and that's the place we're going to end up with skin irritation as a result of the tape. And so a lot of times through the neck or other sensitive areas, you see that right where the tape ends finish, that's where we get these red lines, and most times as a result of putting too much tension, too much stretch in the tape. Okay, so if we dive into our results here, and these are all range of motion looking at degrees. So I combined our rotation and our lateral bending. That's the average of the right and the left side. So we saw that what we can expect is that 20 minutes after we apply a tape, we would see a 4-degree improvement, which is pretty fantastic. And then after 3 days, we see a 10-degree improvement. Again, pretty fantastic in the point where what we're doing in this situation is we're just getting the tape on the skin. It's interacting with the receptors on the skin itself, and it's normalizing the tissue tension, enabling the range of motion to improve. You can also make an argument that the tape maybe straightens gives us a little more postural awareness, and so maybe that stacking up and getting away from kind of that forward head carriage, that also can allow from a mechanical standpoint the increase in range of motion. But any way you slice it, we're getting an increase in range of motion that is not only instant but also continuous and improves as time goes on. Same thing with lateral bend. I think that's a place where if you're tight through the upper traps, if you're tight through the scalenes, if you're tight through the levator scapula for some degree, that's where we would see these improvements in terms of right away or after 20 minutes and after 3 days. The extension improvements, that's where I start, like, we kind of think of we get the tape on the back of the neck, and we're getting extension improvements. So how is that possible? So if we said that the tape interacted with the skin and that normalized the tissue tension, so that allowed us to express more range of motion, so that's great. But if we're going into extension, we would think that the restricting tissue would be through the anterior scalenes and through the front of the neck. So the fact that we saw benefits to this, in my mind, we have two options. Either the tape killed some pain, or Norton modified some pain, and so as a result, you were able to get back further into an extended position, or the tape on the back stacked us up a little more, it got us into a better position, and so getting into extension wasn't as painful from a joint standpoint. But either way, we do see benefits here. And then if we get into the flexion improvements here, that's where, again, we can kind of rationalize that one very easily. We expect to see an instant improvement in neck flexion as a result of those muscles relaxing and allowing the neck to go forward in a more easier and pain-free way. And if we jump to the next slide where we look at the neck pain index, and so essentially this is really a 10-point reported neck pain scale, very similar to the VAS scale. What we saw is and we had room to put the control group on our graph here. So as a result, what we see is right away, or after 20 minutes, we saw a 27% improvement in pain from having just tape on there. And then after 3 days, we saw an 81% improvement, which is fantastic. And then if we look at our control group, we virtually saw we saw a 26% improvement from after 20 minutes, but then after our 3 days, we saw that actually the control group got worse in terms of neck pain. So by putting tape on there, we get 81% improvement. By putting nothing on there, we get 3% worse. And so these are just powerful pieces, especially being the last thing you're doing for your patient. If we get 81% improvement in this study with just tape, imagine if you just did all your normal manual therapies and then threw tape in at the end. All of a sudden, we're seeing some results that are very, very impressive. And then I will say, from our just our raw data on the next slide there, that although I didn't include the control group on the with all the range of motion pieces, we can see there that with the control group we saw virtually no improvement. It certainly wasn't statistically significant, and a lot of times the same thing we saw with the pain scale is that the range of motion actually decreased in the control group as after the 8-day period. So we saw great improvements with our tape and not so great improvements with our control group. And then if we just click through, we'll kind of click through the next graph, which just summarizes exactly what we found. And so what they concluded, which as you can expect, is that the results of this study emphasize the effectiveness of wearing bilateral and symmetrical elastic tape or kinesiology tape for a cervical application after 3 days. And then it's recommended for cervical pain and range of motion in both males and females. And then especially they did go into certain sexes and also with jobs, and so it was most effectively with computer workers, as you can probably expect, just based on posture. And then if we kind of jump down there, yeah, the important parts there is that we got immediate and also long lasting, as in 3-day results from using our tape. Cost effective and just general all around effectiveness. Okay, so we've now covered how getting the tape on the upper traps at this point, but up through the neck and through the second study. How getting the tape on through the traps and the neck had an impact on the pain, also the muscular function, normalizing the state of the muscle itself. We'll now take a bit of a jump to our proprioceptive awareness. We also looked at some neck pain here, but it's the same mechanism of action. You think all we're doing here, we're getting the tape on the skin, the tape is retracting back at ourselves, which we just talked about, and then that retraction lifts the skin up, and then now our brain knows more about the interaction with in that area. It's one of those things that we see throughout the entire body, that the proprioceptive improvements when you have no problems, it's minimal. It may be a little bit better than normal, but it's minimal because you can't become super good. But if you get into a place where there's muscle tension, where there's injury, there's fatigue, we're dealing with an old injuries, and so we've lost control, or our proprioceptive ability is less than it should be. Now all of a sudden the tape gets us back to where our optimal state would be. If we click through, we see what the tape application looked like for this study. So pretty straightforward. We get our Y strip up the erectors, we get our I strip over the CT junction there. Essentially, we're giving ourselves some awareness. And our objective measures, when we did the baseline, they checked it out after 3 days, and they did a further evaluation after 7 days for both pain and proprioceptive ability, and they had a placebo as well. And we'll click through the graphs because we can dive into them. So what we saw was that the right away-ish, which was after 3 days, we got a almost 20% improvement in our proprioceptive ability or our joint repositioning of our neck by wearing tape. And then after 7 days, that improvement jumped to over 40% to a 44% improvement in wearing tape. So again, we're getting the person back to what their normal neck awareness is, and whether they are simply at a computer all day long and they're more aware of their positioning so they don't get hunched forward, or if they are performing at a high level on some sort of athletic field. These are all very important to not only get them out of pain, but to make sure pain doesn't happen, re-injury does not happen. As we know that after an injury, the position sense that we lose becomes a very big indicator of a re-injury or a recurring injury. No more obvious within an ankle sprain, where just because that becomes more of a kind of a gross, obvious thing, but that is something that is continuous throughout the entire body in terms of awareness and ability to regain that proprioceptive function. And then also, if we look at our pain after 3 days, we saw a 16% improvement in neck pain, and then also then after 7 days, a 44% improvement, or a 44% less pain than where we started from at baseline. Awesome results, really good results from a result of just putting tape on and nothing else. And then as a result, we saw that they concluded that the kinesiology tape application significantly decreased joint reposition error and visual analog scale or pain scale after 3 days and 4 days. They did do a placebo that was at a different tension. And so I think that if we kicked that out and just looked at from the baseline, our NDI scores would be similar as well. But as a result, they include that combining it with exercise, that we all of a sudden have these great results as we constantly see over and over and over again in these studies. All right, so if we jump into our last study, this is our text neck study, more of functional example of things we would see in practice. A pretty cool study that they looked at using the EMG response to using tape. And the interesting part is that they put tape on the upper trap, as you can see here. They had this subject text with the head forward for 30 minutes. And they looked at they didn't look at the result of the trap itself. They looked at the global results through the erectors of the neck, through the lower traps, and through the serratus anterior. They looked at the muscle reaction as a result of the text position. So they had people text without tape and text with tape, and they saw the results. And so this kind of makes us think of the benefits that can be seen from postural awareness. And postural awareness doesn't need to be we're locked in this position and we can't move. It can just be postural awareness with some amplified area of the skin with a slight little bit of tension. And that is the huge benefit that you have as a clinician, is when we're talking about some sort of postural improvement or putting some tension through the tape to try to promote a postural improvement, you have the ability to decide exactly how much tension you put on the tape. Me personally, I'll always bias towards having someone have less tension than usual, less tension than more tension, simply because more tension leaves us vulnerable to skin irritation, as I mentioned before. So if I can get the same results without tension and have no one come back to my office having skin irritation, well, that's a win. And as a result, I really have very, very few people coming in and saying they have skin irritation as a result of tape. And I'm putting the tape on many people through the day. We're looking at, like 30, 40 people a day putting tape on, and I really don't recall the last person who came in saying they had a big reaction to tape. So, and that's because I'll bias towards really making sure that the person is never running into range of motion, and I'm never putting too much tension on the tape itself. Okay, so as I mentioned, we looked at the global results of the tape on the upper traps, and we looked at both, there we go, yeah, so we looked at both pain, muscle activity, and muscle fatigue ability. So with the neck and shoulder pain, and I highlighted just the erectors. We didn't go look at the lower traps and the serratus, but if you click back to the previous slide, you can see that you see there that the raw data is there, and they ended up essentially the exact same results benefit-wise that the erectors did. So if we click back, yeah, exactly. We see that 26% improvement in neck and shoulder pain score is a very reliable example. And then we see that the muscle activity, we saw a 20% improvement in terms of normalizing the muscle activity. So again, this is looking at the erectors. So there is a 21% decrease in the muscle activity as a result of the texting position compared to where they are at baseline. So as you can imagine, being in a head forward position forced the erectors to go into a higher state of activity because of the poor posture. And then the muscle fatigability, which is something they looked at based on your ability to isometrically muscle maximal contraction. We saw that there was an 18% improvement or a decreased fatigue in the person who has tape on versus the person who doesn't have tape on during that postural position for texting for 30 minutes. And as a result, they conclude that study findings suggest that the utilization of kinesiology tape on the shoulder during 30 minutes of smartphone texting can improve neck shoulder discomfort and decrease neck and upper trunk muscle fatigue and activations in healthy young adults. Something that we deal with all day in our clinics as a result of just the postures that people end up with at school, at work, and now at home. So yeah, this is something that gives some thought to, because just by adding this into your practice, you can help a lot of people if we just make this the add-on to all the great things you're already doing. Okay, so we're going to dive into a couple examples of how we would tape for different type of neck positions and postures, and give you some ideas as to how you can use kinesiology tape, how you can use Spidertech in your daily practice. So give us a moment here as we kind of jump into our files. Good. Yep. So for this example, we're going to go really simple. We're going 2 eye strips. And what we're after here is to have an impact on the erectors what we're going here is have an impact on the CT junction. And so I would commonly use this one for someone who gets that forward head carriage, someone who has a lot of kind of flexion angle at that CT junction. And if we want to have kind of a proprioceptive impact at that area, trying to promote more of a straight neck, more of a extended position, more of kind of a stacked up, this is what I would commonly use. And then we also get the benefits as it crosses over. We get kind of into those scalenes, the upper traps, and then down into the levator on the opposite side. So a great one to use, simple to apply, takes literally 2 seconds. It will stay on there for 3, 4, 5 days, maybe more, depending on the oiliness of the person's skin and how much kind of wear and tear they put on through the day. But a great one to start with for general application for CT junction kind of hyperflexion. For our next one here, we're going to use a low back. We'll use our low back pro cut. And the interesting thing about this one is we get full neck coverage. We get impact over our upper traps. We get impact over our erectors. We could put a little bit lateral with the bigger strips to go over top of the levator if you wanted to. Really simple to use. You notice we're flexing and stretching the area that we're putting on. So here, we flex the neck to put it all the way on. When I get into the upper traps, I'm side bending to stretch the upper traps. When we get into the erectors, I'm flexing the neck forward. And then when we get into that opposite side upper trap, I'm side bending away again, making sure that we never run out of range of motion. In that, if we apply the tape on the skin in a neutral position or a flex position, then as they extend away, the tape only has 40% stretch in it. So if the range of motion of the neck exceeds that 40%, now either the tape's going to give or the skin is going to give. And I promise you, we do not want either one of those situations. Great. If we move on to our next piece here. So we didn't mention any fluid transfer or having an impact on the lymphatic system, any swelling, inflammation. But here's a great example of how I'm going to tape if we do have that issue. If there's some swelling, if there's puffiness, if lymphatic drainage in the CT junction there is a common area for things to get puffy and inflamed with our lymph nodes and with any kind of lymphatic issues. So this would be how I would tape to have an impact on the lymphatic system or any kind of fluid issues throughout the body. And the reason being is that we get the benefit of our fan, which is the lift of the skin, but we also get the alternating tape and no tape, which creates pressure changes or pressure differences from tape to no tape on the skin. And so we get the fluid moving towards the tape underneath, or the skin underneath the tape, which helps the fluid move out in a more effective and faster way with the fan. And so we see here that we can have a bilateral effect by just crossing that fan. What I will say is I was very careful here, or I was aware that I want the ends of the tape to finish over skin, not over other tape. And the reason being is that the tape adheres to skin better than it adheres to cotton of the other strips. And so it's okay as we cross over top, but for longevity of application, we want to make sure that we're finishing on skin itself. All right. So some fantastic examples there of how we can have an impact over different postures, different positions, and different ways to tape for our patients. If we click through our next slide there, we'll kind of revisit our subgroups that we wanted to have an impact on, or we wanted to explain or talk about. We covered neck pain, and for the most part, we looked at that from a muscle tension standpoint, but we also got into how the tape potentially has us improve our posture, which has an impact on the mechanical structure of our neck and thoracic spine. So certainly we can have it a joint impact as well. We saw that how we can improve muscle tone, muscle stiffness, trigger points was something that we visited with a number of these studies. As a result of the muscle tone and stiffness, we improved our range of motion, and then our proprioceptive ability, which is a good indicator of our ability to kind of move through our rehabilitation programs and regain our normal awareness of where we are in space and regain our normal function of our neck. And then lastly, we gave a little bit of an example as to how we can help virtually everyone we see as they get flexed forward and curled up into a ball as a result of their phones and their computers and everything else they do in their life that doesn't get us into an extended position. All right, so if we take a peek here at our leaving our lasting impression, and that's really simple when you have a fantastic product that has an impact over many different things that we treat in our clinics. It is the treatment between treatments. I mentioned that many times. This does not take the place of anything you're doing. This is the add-on. This is the thing that you have a choice between doing or not doing. And you can have an impact. And I mentioned how I have such a great result using it because I was able to have an impact on my athletes when they were not on the table. I was able to have an impact on them when they were on the tennis court and on the golf course. And so they felt my presence, they felt improvements, and they were able to perform better as a result of me really being smart enough to apply kinesiology tape. And then lastly, it does become a business card, and certainly through the neck, that is an area that people see. It gets on here with our tape, with the pre-cut shapes that are clean, they look good. It is a conversation piece. It is something people ask about, And so every time that someone sees your patients or your clients, they ask what's going on with their neck, they talk about your therapy, and it's something that maybe not everyone is doing. And so now they're like, they did what everyone else does, plus they added in tape, and now it feels amazing. That's maybe someone I should be looking into. So that's commonly a way that I will build my practice, by just putting high quality, visually appealing tape on them. All right, so that concludes our first webinar of season 2. Let's jump into our questions, if there is any, and happy to answer any thoughts or questions that you have about this or other topics. Guess I missed that one, Joe, I'm sorry. Hopefully the background talking improved throughout. I'll give anyone a chance to throw in any questions that they may have, but we can see here with the application with our fan, that would be a great example again as to if we had upper trap puffiness, soreness. In this case, it would be after a hard workout with the picture that we see there, getting kind of some delayed onset muscle soreness in the upper trap. That fan is a great way to help flush out the byproducts of muscle breakdown after a hard workout, whether it's creatine kinase, lactic acid, to allow the fluid to move out of the area. We also get that constant rubbing, so we get the benefit from a pain standpoint as well, and we can expect a range of motion increase. So again, our fan example of that fluid transfer. Yeah, leave it to the audience. Patty, the guys tell me that there's maybe have a question that. Yeah, it is apparently better to type it out, if you don't mind. And what I'll do in the clinic is, we saw with our examples, we had we had the eye strips, we had the low back pro cut, we had different shapes that make it easy to tape for the neck. If you have those shapes ready to rock and they're part of the treatment room, it's just such a fast process. It's 30 seconds at the end of the day, end of the treatment that doesn't take up any time whatsoever. So this is something we can add in, and it's just simple, and not a time suck in any way, or it doesn't change how the speed of our day or the flow of our day. And I will say that we do have a Q&A session tonight at 5 p.m. as well. If any questions come up, then we'll be doing a live Q&A that everyone can kind of join into on our school's platform, which is a fantastic place to join. If everyone here is not in there, it's where we host all of our education content. It is completely free for medical practitioners, medical professionals. And you get all of our courses, all of our educational content there completely free of charge. and it's a place that you can connect with the rest of the medical professionals in a community, ask questions, throw out ideas, post your own videos that we can kind of get in there and just brainstorm about and get better at tape. How to tape to facilitate rhomboids and scapular stabilizers after a posterior C-spine fusion, C4 to C7. The individual also has a rotator cuff repair for a large tear, poor results. I will answer the real fast, Patricia, before I jump to that. It is all in there with hours for continuing education credits. It is all non-structured hours, so you can list it as your CE credits, but it is not official structured hours with the free education online. But it is there for non-structured hours, and there's many non-structured hours for you to work through. So, Patricia, back to our question there. So we have someone who has a C-spine fusion, and then we're trying to facilitate the rhomboids and take care of our rotator cuff tear. So, how I'm going to attack this, I believe, is I would think about doing some sort of structural application at in between the shoulder blades, mid T-spine. And so I would probably use our postural ProCut if I had it handy. That would be the best piece for the start with. So I would go in between the shoulder blades. I would put it on in between the spine, have them take a ideal posture, which we'll call anatomical position. I would apply the tape on over top of the mid back without stretch. Because everything is going to kind of take them forward, and so if we go too hard on the structural resistance, we're going to end up with some skin issues. So enough that they kind of want to get here, and I would also put on 2 eye strips or the low back piece that we saw over top of the erectors of the neck, I believe, but I'll leave that up to wherever you feel the neck tension is. If the neck tension is over the erectors, if the neck tension is over the levator or the scalenes, I would just get coverage over the area where the tension is to cover the neck. And then that's probably how I would start. If I was finding that the rotator cuff issue, he was getting a lot of rotator cuff either anterior roll forward at the GH joint, I would consider kind of having them kind of getting some tape over top of the glenohumeral joint as well. If I was finding that they were getting a lot of shoulder hike like so, I might want to get some tape over top of the upper traps to prevent a shoulder hike. But the place I would start for sure would be postural in between the shoulder blades, and then some tape up over top of the neck, depending where the muscle tension was. And then think about how you can, and then probably deal with the shoulder piece secondarily. Because the mid-back taping might clear up the shoulder or have benefit on the shoulder just by doing that. Patricia, does that create any thoughts? Do you have any kind of follow-up to what I said there, or does that, do you think that is enough to start with? Yeah, excellent. Excellent. So how I would generally go, I mentioned the GH joint. If I was taping to try to prevent that rolling forward of the shoulder, I would I would take them into external rotation and then tape around the shoulder down the mid-back. If I was trying to tape to prevent a shoulder hike, I'm going to have them take anatomical position, bring the tape up from kind of just around the collarbone, the clavicle, and up around over top of that upper trap, and then down the back as well. So essentially, I'm in both situations, I'm trying to start them in the position I want them to promote. So external rotation of the shoulder, or trying to get them into a kind of long neck, anti-shoulder hike position, and then I would just tape in those positions to make sure that we're not getting too much structural support, which could end up in issues. Yeah, so I think you're saying, so should you expect to see them be able to hold things in their hand without bicep pain as a result? Yeah, I mean, that certainly would be the objective. If bicep pain, yeah, okay, 6 weeks immobilized. If bicep pain is an area that they're having issues with, if there was a repair there, it's certainly from a proprioceptive in a muscle tension standpoint, I would get some tape over top of that as well, and then continue your rehab process to kind of getting them going as fast as possible, both from a muscle function. Without resistance, and then building back into a resistance standpoint for sure. How much is too much tape? Yeah, I think that is very much individual based. I do think that it kind of depends what we're attempting to do. I generally will start to kind of pick on one area at a time, and then kind of make my way through. And because I like to see kind of where we have the best results as well. So I don't think there's a downside to having more tape, but I am aware that it's the potential. There's more sensitivity to having one spot that there's rub on the skin, and your brain aware of that one spot versus just everything being taped up and kind of going crazy. So I would generally try to kind of tape one complex at the time, whether it be kind of the shoulder. I'll do a shoulder and mid-back, I'll do a shoulder and neck. I think those two things go great together, but I'm not going to do a lot of times like a shoulder or a low back, a hip, foot, like an ankle. So I would keep it more to one complex at a time, unless there was a connection from, for instance, if there was like a right shoulder, left hip issue, I would connect those two things together commonly. I think maybe the answer to that too is like, just if you're aware of or if you're just thinking through what the tape is doing, you can conceptualize what will have the greatest benefit to the person. So if we're thinking that one thing affects the other structure, then getting the tape over top of the primary issue will have the greatest impact on the person's body. Yeah, fantastic, Patricia. So we've gone. We do our in-person education still, but we're just about to launch our newest online version, and I believe it goes live on Thursday, so in 2 days. And so I would suggest checking that out, and that will be on our school's platform, and again, free of charge completely. If you do want some in-person education, there is options there, and contacting us would be the best way to look at that. But the online piece that we're about to launch would be the no-brainer, the place to kind of to reintegrate with Spidertech, and then kind of continue on from there, both from a cost and from a convenience standpoint. And then it will also make everything you do going forward just that much easier from if you do go down the road of an in-person course. And it is our direction that, and it is our belief that we want to provide all our medical professionals with as much education as we can, free of charge. We want you to be as knowledgeable as possible in this area. So because we know we have the highest quality tape, so we're banking on the fact that if we provide you tons of information, tons of knowledge, and you understand, conceptualize how to use kinesiology tape in a better way, then we're going to end up selling a bunch more tape as a result of just from a higher usage standpoint. So that's the reason why we've gone to completely free of charge education, and all on our online piece on our school's platform. It's pretty exciting. Well, thanks everyone. I love the engagement. I love getting here and being able to chat with everybody. And we'll do it in 1 month time. We're going to look at the thorax, and so all the posture questions that we just had with the having an effect on the thoracic spine, on the shoulders and posture, we'll dive into in a month or so. And I can't wait to get into season 2, episode 2, in December. So hope everyone has a great day. And again, if there's more questions that come up tonight at 5 o'clock, school's platform, we will do a live Q&A for 30 minutes. And so come there with your questions and your interactions, and we'll do this one more time.